Hello friends, today I will talk a little bit about salt. So some people have asked which type of salt to use and also how much salt is okay to take. So the issue with salt, as you may be aware, is that having too much salt in our diet carries the risk of increasing our blood pressure. And if you already have high blood pressure, then definitely you need to reduce your salt intake. So most of us actually take more salt than we need to in our diet, and we don't actually even realize that we're having this extra salt. So there's two ways we're getting salt into our diet. One is through cooking, when we are making our food, so we need to be aware how much salt we are adding, and it's a good idea to try and limit and reduce that salt intake. The other thing is in our foods that we buy in the supermarkets, especially packaged foods, we need to be aware that a lot of foods contain a high amount of salt. Things such as olives, cheese, things such as cereals, breads, all sauces, and so any type of sauce such as even ketchup, everything or that comes in a packet usually contains salt. So it's really important that we look at the labels. So first of all, I'm going to tell you how much salt is okay to have in our diet as an adult. So no more than 6 grams per day is the recommendation. So that in a rough way, I would think of it as 1 teaspoon is the maximum amount. But you need to be aware of all the different ways we are getting the salt, not just what we are adding in our cooking, but actually what we are having in a hidden form in packaged foods. So please do check labels. Now, in terms of labels, I would like to tell you that the amount of salt that is okay, like what is a good limit to go by, is 0.3 grams of salt per 100 grams of the item. And if we're looking at sodium, in terms of sodium rather than salt, it would be 0.1 grams per 100 grams. Anything more than that, then it becomes out of that low range. Now, in terms of which type of salt, I would say it's less important which type of salt you are using. The most common type of salt used is common salt. That is the finely ground salt. Now, the thing about that one is that it's easier to know how much salt you're actually using. The other types of salt that we have that are like Himalaya salt, or you have Celtic salt. I mean, these salts are also okay. They are not so ground, they're not so fine, and they can contain some minerals such as calcium, magnesium, but the amount of minerals is very little. So it's not enough to think that we are having a good diet in calcium or potassium or magnesium from these salts. So that would not be a good reason to have these salts in our diet. If you like the taste of these salts, it's fine, but I would recommend in cooking you use table salt, so you know exactly how much you're putting in. And on the table when you're eating, it's a good idea not to really add any extra salt. So I would, one main message to take from today's video is that if you have high blood pressure already, I would advise to reduce your salt quite a lot, because that can bring your blood pressure down by a good few millimeters of mercury. So that is good to do. That's a good one step you can easily do. So maybe half the amount of salt you are already using in your cooking, and I would take out things like pickles and sauces from your diet, or make them as a minimal something that you take very minimally or once in a while in a very small amount. So that's what I would say. The other thing I would say is please do look at labels. It's really important, and it's very important we don't take too much salt in our diet. So yeah, so at the table, sometimes people like to add extra salt on their food. It's not a very good idea. I would try to stay away from that habit. So thank you for listening today.